Okay, so we're going to go through a refresher on PPE and donning and doffing and the different types of precautions. So PPE, personal protective equipment, it's a very popular phrase these days, but it's important to remember when it's necessary to use it and ensuring that we've had proper training, which we're going to cover a little bit later as well. Ensuring proper fit, especially with respirators such as N95 masks, and ensuring that the PPE is not damaged or defective in some way. Next slide, please. So PPE consists of many different components, such as gloves. So anytime we might be touching any blood or bodily fluids or contaminated surfaces. Gowns, anytime we think that we might have any contact with our clothing or our exposed skin, to any blood or bodily fluids as well. And then mask, eye, or face shield protection whenever we're concerned that there could potentially be any splashes, sprays of any of those fluids as well. Next slide, please. So standard precautions. So standard precautions, we should be using these for all patient care. They protect healthcare providers from infection ourselves and also preventing from the spread of infection from patient to patient as well. So hand washing should occur with every single patient, no matter what, washing in, washing out of every encounter as well. Ensuring proper kind of coughing technique too, handling of equipment as well as injection practices, ensuring that there are proper containers for those that are easily accessible and easily visible as well. Next slide, please. We'll start with contact precautions. Contact precautions, these should be used anytime there is concern for possible direct or indirect exposure to the patient in their environment as well. So anytime, say that there is diarrhea or concern for an abscess, we should be using PPE with gown, gloves, and of course our hand hygiene at minimum. Sometimes too, depending on the case, I'm using dedicated disposable equipment, such as a stethoscope that stays in the room, or that's able to be adequately cleaned in between uses, person to person as well. It's also important to remember that before exiting the room, that we need to leave the gown and the gloves in the room. Next slide, please. Droplet precautions. So these would be used for viruses such as influenza, adeno-rhino, and bacteria such as strep and pertussis, anytime there's risk for spread by large respiratory droplets. For these, we're going to want to use a face mask in addition to our hand hygiene as well, and making sure that that face mask, again, is properly covering our face, our nose, and our mouth. Next slide, please. Airborne precautions. So these are diseases that are spread by small respiratory droplets. So these would include things like our measles, our varicella, and tuberculosis. So in this case, again, we should have been using airborne precautions. Again, it might not have been clear initially that that's what we were dealing with, but once we knew that we were dealing with measles, we need to make sure that proper airborne precautions are occurring. So that includes having gloves, gown, and a respirator, such as an N95. Next slide, please. So once we know we need to use the PPE, it's important to understand how to properly put that on and then also take it off. So when we're putting on, again, we should be washing our hands before putting on our gown, ensuring that it is fitting well. So making sure that we tie, that it's not draping in the front, that again, that it's covering our arms as well, that there aren't any gaps. After we put on our gown, then putting on our mask or our respirator if it's appropriate. And then lastly, again, goggles or face shield if needed. And then our gloves, and ensuring that we tuck our isolation gown into those gloves to make sure there's no gaps in coverage of our skin that might become infected by any contact with the patient as well. Next slide, please. When it comes to doffing, there are two different options for this. The first option is to first remove our gloves, then our goggles, gown, mask, and then return to our hand hygiene. If at any point, though, in time between any of those steps, we contaminate ourselves. So if we accidentally touch the outside of the glove, we need to stop and then wash our hands before moving on to removing our goggles, and vice versa with gown 2. And between any time we think we might contaminate, make sure that we're stopping, washing our hands as well. Next slide, please. An alternative would be to remove the gown and the gloves at the same time, and then move on to the goggles, and then the mask, and then lastly, making sure we're doing our hand hygiene as well. Next slide, please. Besides following proper precautions to prevent disease and transmission to other patients and healthcare providers, we also need to be mindful. So anytime there's any soiled equipment, we need to make sure that that's being properly taken care of in a timely manner. When it comes to environmental control, cleaning highly touched surfaces frequently, the CDC has 4 components of culture of cleaning and disinfection, which include integrating environmental services into our culture, because they are a very important part of our team as well. Making sure that we're selecting appropriate cleaning products, standardizing the cleaning protocols, monitoring the effectiveness and adherence to these protocols, and then providing feedback, ensuring that we're doing all those steps correctly. Ensuring that we're properly disposing of needles and sharps. Containers should be, again, in a location that's easily visible and accessible. And then patient placement. So during the COVID-19 pandemic, this is very popular to split up the waiting room into one side being sick, one side being well, or even breaking the day into morning for sick visits or well visits, and vice versa as well, depending on the risk. So if there's a patient coming into the office that, say, again, the school nurse had identified and was concerned for measles, and they're coming into our office, maybe that's a patient that we should have wait in their car or be the last patient of the day, just to make sure that we're minimizing any potential risk or exposure to any other patients as well. And then every member of the healthcare team, really, we have a duty to try to ensure transmission of diseases is as low as we can, trying to minimize by just doing at least the bare minimum of our standard precautions. And then again, trying to strategize based on what we know about what the patient's symptoms are. Do we need to go above and beyond? Do we need to look into other precautions, contact, droplet, airborne, and making sure that our other providers in our office are aware as well.